if while waiting, there is a conversation going on a meeting chat. It will be great to know who's here, and if you can introduce yourself and a bit of a fun fact about you and where you're from, will be great to know all the participants here. So please, while waiting, you can go to the meeting chat and introduce yourself there. Thank you.
Hi, Jessie. Can you open the chat? It seems to be only for the organizers at the moment, please.
Okay, I think I have to add you into the channel, so hang on a minute.
Okay, so good afternoon to everyone and good morning to some of our colleagues who are joining from Geneva and other part of the world. I would like, on the behalf of Regional Health Team, I would like to welcome you all in the fourth technical webinar organized by the Health Unit. And this week we will be focusing on community-based health and first aid for COVID-19 operation. And in today's webinar, we'll be mainly hearing from our expert from the Geneva, like how the CBHFA and the CBHFA volunteers can be maximized in the COVID-19 operation. We'll also then hear some experience of some of the national society working in COVID-19 operation, like how the CBHFA or the community-based health approach have helped them in COVID-19. Without wasting too much of time, I will first start with a general update on the COVID-19, how our region is faring, what is happening in the region, priority countries, and what is hot on the desk. And after that, I will give the moderation to Nadira, which will then take you through the CBHFA and COVID-19 webinar. So, Jesse, can you please confirm whether you can see my slides and hear me okay?
Yes, Abhishek. I can see and can hear you.
Thank you very much. So this is our Asia Pacific dashboard. As you have been visiting this website quite often, and as of today morning, like we have 27 countries with confirmed cases of COVID-19. Only one country, that is Indonesia, has community level transmission of COVID-19, whereas Bangladesh and Thailand, their results are still pending, whether they will be labeled around the cluster of cases or the community transmission. So we are finally waiting for those results. There are more than 84,000 active cases and more than 8,000 deaths in Asia Pacific. If you see the global figure, the number of cases have already exceeded 3 million and the number of deaths has already exceeded 200,000 globally. If we see Asia Pacific region, India, Singapore, Japan, and Pakistan are really driving in this pandemic in this region with maximum number of active cases. And if you see the number of deaths, it is India, Indonesia, and Philippines, excluding China. These three countries are active, having largest number of deaths. We have not counted China in here because they have already more than 4,500 deaths. So India has almost more than 900 deaths. Then Indonesia is climbing up very fast with more than 700, and as well Philippines is also above 500 deaths in this region. Bangladesh is one of the country where there is a very fast rise in cases. Over the period of 1 week, there is a 500% increase in number of cases in Bangladesh. And according to Global Health Security Index and Infectious Disease Vulnerability Indices, Afghanistan, Democratic People's Republic of Korea, some of the Pacific islands like Kiribati, Solomon Islands, and Bangladesh are the countries with maximum, which can get the maximum impact of this disease if the adequate measures are not put in place. So we are having a very close eyes in this country as well. I would also take this opportunity to introduce to you all the COVID-19 Health Help Desk. We have already sent email to all the country office and country cluster support team to disseminate this information to all the national society. So this is an initiative taken by the health team in Geneva with the collaboration with GDPC, in which we designed to form a one-stop platform where you can find several guidance and resources, because we know that there are more than hundreds of documents that are available. So you can go there and try to see it is really classified as community-based health or migration or clinical service or any other sector. So you can really go and see what guidance you need and what guidelines you will or tools you need for your work in the national society. So those guidance are available there. It does not need any password, nothing. You can just go to this website and then you can find all those resources there. There is also a section on frequently asked question, and there is also one new tab around the direct technical guidance. You can directly ask question by filling your name, the name of the national society, your position, and you can directly type in the question there, and we'll try to get back to you within 24 hours of your question. So you can get direct technical support as well. And there is also some learning webinars and some learning webinar sites given there, so that you can go and listen to several webinars that had happened across the globe from this organization and outside the Red Cross Red Crescent movement as well. This site has just come into existence last week only, so it is continuously improving itself. Any suggestion, feedback to improve it or to add something else to this will be highly appreciated by the IFRC from the National Society. So this is it from my end for the just general update. I'd like to hand over back to Nadira to take the webinar forward. Thank you.
Thank you, Dr. Abhishek, and may I extend my welcome to everyone who participate our webinar today. And we have roughly around 53 people and more to come. So I would like to start our webinar today with our first speaker, that is Nancy Claxton, our Senior Health Promotion Officer in Geneva. I don't want to go too detail about her experience. I think she's very well known in this field, and I think most of you has probably worked with her for the past few years and whatnot. And she's very well have wide extensive experience on this. So I don't want to go into too detail about her experience. Let her presentation speak on how much depth she knows about this topic. So I'm handing over to you, Nancy.
Thanks, Nadira. I appreciate that. Good morning or good afternoon, everybody. My name is Nancy Claxton, as Nadira explained. So I work in Geneva, but I really work in the field. So I get to work with people like you who are doing all the hard work in terms of working a community, which is what the movement says our strength is, and it is. So we have about 7 million CBHFA volunteers around the world, but Asia Pacific is one of our leading regions. You teach the rest of us so much in terms of how to do community health appropriately, how to ensure people's needs are met, and how to ensure that we're working with vulnerable groups. So thank you for teaching me so much, and I am looking forward to continue learning from you. So amidst COVID, of course, the beauty of COVID is that once we started to see that COVID was expanding outside of China, we saw that CBHFA volunteers were kind of jumping right into action. So they were shifting from doing development or peacetime activities into recognizing that this was an epidemic and that they needed to provide more support. So that support was provided in a number of ways. Some people were still doing household visits, although a little bit differently, because they were talking through windows, or they were talking through open doorways, or they were having a social media presence where they were talking with people through WhatsApp or Instagram or other channels to be able to discuss with the community how to serve them. One thing that we've noted, though, is that behavior change is something that's continually being raised. So people are talking about behavior change, behavior change. However, as you as my CBHFA volunteers know, is that what we're seeing mostly is knowledge-based behavior change content. So I only have 15 minutes, so I'm going to focus on some behavior change activities. I know that in Indian Red Cross, they're handing out handbills and leaflets on prevention. Bangladesh Red Crescent is doing the same thing with Facebook Live. Singapore Red Cross is actually doing a little bit beyond knowledge in terms of calls and doing two-way communication. So I just want to talk you through some of the behavior change principles, just a reminder, a refresher course, and talk about how we can use that lens of behavior change to ensure that it is meeting the needs of people and actually changing behaviors rather just than using that term and actually not influencing behaviors. Okay, Jesse? I'm not sure who's my slide person. Oh, okay, so we know that behavior change is the most effective. So I keep hearing people say, well, we'll just make them do behavior change. Well, we can't make anybody do anything. We have to use our knowledge of behavior change to actually change the way that they are doing specific behaviors that may contribute to the transmission of the virus. So we know and we see that COVID is being transmitted at the community level. That's where most, if not all, of the transmissions are happening. And CBHFA volunteers are the perfect workforce to be able to combat that. So we, as a group, as a family, can slow the rate of infection globally so that people can get the help that they need when they need it. And we can give them support in terms of information, in terms of understanding when they need additional care, in terms of providing psychosocial support, all that stuff that we do as CBHFA volunteers, that we're so well suited for helping people to respond to coronavirus and to ensuring that it doesn't get transmitted to the next person. Okay, slide. I think I can turn the slides. No, I can't. Oh, yeah, I can. Okay, so this is what we're seeing. We're seeing volunteers that are standing outside of houses, calling in, and basically checking in on people. So mostly with older people, sometimes with vulnerable people, like people who are disabled or have some type of disability, people who are geographically distant, people who may not be comfortable with coming to a healthcare clinic or for coming for a test. And so our volunteers are liaising with people where they are in a safe way. So we're not saying, nope, discontinue all household visits. We're just saying, why don't you modify the way that you do the household visit to keep you, the volunteer, safe, and also to keep the community members safe. Now remember, as CBHFA volunteers, you are role models. What you do, people do. So if they see you hanging out with people and hanging on their arms and touching people and kissing them hello, then they think, well, the Red Cross is doing it. It's safe for me. So we have to model what it is that we want people to be able to do. So here's our volunteer. She's checking. She's a good more than 2 meters distant from this person, giving information. And so this is what we're advocating. Okay. So we are basically giving content or messages about how the virus is transmitted and how to stop the transmission of the virus. Okay, so we heard Abhishek talk about the numbers, and we understand, I think we all understand now how it's transmitted and how to stop the transmission, but we are still hearing so many rumors. So as from a behavior change lens, we are going to continue to say the right behavior. What we don't want is we don't want to say the wrong behavior and then say, but that is the wrong behavior. So I'll sometimes see a video where somebody shows somebody like sneezing into their hand or kissing somebody on the mouth, and then there's a big X through it. That's actually modeling the correct behavior, even though there's a big X on it. We're modeling the correct behavior by showing an image of the incorrect behavior. So we want to continually talk about the facts, how it's transmitted, how to stop transmission of virus. And that needs to come out in our messages verbally, as well as any visual messages that we develop, as well as that modeling, as well as how we stand in front of people, how we conduct ourselves in the community, how we act, what we do on a regular basis. I recognize that you're not all volunteering 24 hours a day, 7 days a week. However, you are always seen as a model. So recognize that you have responsibility as CBHFA volunteers to model that behavior. Okay, so we continue to stress how it's transmitted, how to prevent it. And when people come up with crazy things like, I hear that garlic can cure COVID, or I hear that if I have turmeric every day, I won't get COVID. We don't say, no, you're wrong. What we say is, COVID is transmitted this way. The only way to prevent COVID as these behaviors, hand washing, sneezing, coughing, and spitting etiquette, we continue to say the same messages, okay? So we're combating ignorance, we're combating rumors with the correct information constantly, okay? So we also tell them what to do when they don't feel well. So we see that there's a huge transmission of this disease. So instead of just talking about prevention, we're also talking about how to provide support to the people who are sick. If you feel unwell, stay home and rest. Isolate yourself from others in your house, if at all possible. We get that some people live in shelters or in places where they can't necessarily separate as much as possible. But if that's the case, there are other measures you can take to keep yourself safe. Wear a mask, wear gloves. If you can't breathe, seek care. So we don't want volunteers to turn into mini doctors, but we want them to know what to do when they come across somebody who needs support. Okay, so here's our stages of behavior change. As you know, knowledge is all about giving information. Approval and intention is basically getting people to change their mindset and say, yes, I will do that new behavior. Practice is actually doing the behavior, and advocacy is what we are, what you are. You are advocates of how to prevent coronavirus. So be safe. You see my two volunteers. This is a picture from Ghana. I've got two CBHFA volunteers, and they're standing very close to everybody in the market, and they're talking about staying 2 meters from each other, and they're talking about hand washing, and they're talking. But what do you see in the picture? You see our volunteers. There's another one back here. They're all standing very close. They're not modeling the correct behavior. So they're giving knowledge, and yet everything that they're doing is saying the exact opposite of what we want them to capture from that. Okay, my slides have gone away, but I'll continue talking. Well, Jessica, if you could put the slides back up, I'd very much appreciate it. So what we want to do is we want to ensure that we are moving past knowledge when we are talking about behavior change. Okay. All right. Thank you, Jessie. Everybody needs Jessie in their life. Okay, I went way too far, sorry. All right. So we have lots of awareness campaigns. This is in Bangladesh. The press is doing a lot of knowledge campaigns. I'm hearing about a lot of national societies doing knowledge-based campaigns. It's not a bad thing. Like I said, there's a lot of stigma, there's a lot of rumors out there. It's not bad to give information, but we are at that stage in the pandemic where we need to also make sure that we are doing intention, approval, and practice. Okay, how do we get there? So how we get there is we make sure that we are capturing information from people who have suffered from corona and survived, and from people whose loved ones have gotten corona and have not survived. So remember, it's that personal touch, it's that personal story of how getting corona or getting COVID has actually affected their lives in a negative way. So getting people to approval and intention is hearing the stories from the field of how it feels to have COVID, how it feels to have your mother die of COVID and you can't be with her because you're not allowed in the hospital, how it feels when your brother has COVID and you can't do anything for him because he is isolated. So what we want to do is we want people to feel that. And when they feel that, then they say, you know what, you're right. I have to stop hanging out with my friends. I have to stop going on public transportation unnecessarily. So this is the way that we get people to approval and intention. Now, this can be done through social media. I saw that the Bangladeshi Red Crescent also has a Facebook Live, which allows for two-way communication, and they can use that channel to have people who survived COVID come on and talk about how it affected their lives, how they're now having problems with their kidneys, or how they're having problems with their lungs, or how their uncle died of a stroke because that was a complication from COVID. So they can use that channel that's already set up to be able to move to people to approval and intention. And how do we get people to practice stage? Some of you have already done it. So here we've got a community in the top left-hand corner in Indonesia. They're separating people with the 2-meter mark. Now you can see at the beginning of the queue, it starts out great. Back here, it hasn't gone so well, but that's okay. They're starting to do practice. The bottom left-hand corner, we've got a woman modeling how to put on a mask appropriately. We have not told people that they have to use a mask because we've been concerned about people not using the mask appropriately, not putting it on appropriately, not taking it off and disposing of it appropriately, which means that mask is another vector for the transmission. So when volunteers are modeling the correct way to use a mask, not pulling the mask off and sticking it in your pocket and then putting it back on a minute later, but when you're modeling it and you're showing people and you're using it very seriously, then that helps them to understand how to use a mask appropriately. Here's my volunteer in the middle who's talking from a safe distance to the vulnerable group. In the Philippines, we've got water barrels with hand soap that are in different areas. I'm not sure where this is. I'm sure Ellen could tell me. But these are, I think, placed throughout the Philippines. Is that right, Ellen? I'm not sure. I found it on your page, so I'm assuming that they're well placed. And then we've got a guy at the bottom who's finally sneezing appropriately, and so he is modeling the best way to sneeze. Okay, so these are all practice. So it's being a model for what it is that you want people to be able to do. Okay, and so now because you're making so many knowledge messages, what I wanted to do is to give some feedback to you and a reminder of what we're looking for when we have effective COVID messaging. Now, COVID is considered an emergency. So it's a threat. Instead of talking about the benefit, we want to stress the threat of it. So we want to make sure it's simple. We want to make sure we're telling people exactly what to do, not what not to do, and then correcting that, but what to do. Telling them that it's a threat, making sure that it's appropriate to your community and your context, and that the community has given some feedback. Okay, so let me give you an example. Okay, I've only got two. This is from the Philippines. Okay, this was taken, I'm not sure if you can see it, but it's a coffin or a casket in the middle of the street. It says stay at home or stay inside. Is it simple? Very, very simple. Is it communicating a threat? Yes, that coffin tells me that I will be dead and have to stay inside if I don't stay at home. Is it telling me what to do? Is there a call to action? Yes, it's telling me to stay at home or I'll be in that casket. Is it appropriate for the context? I assume so. This was done by a team in the Philippines. I'm not sure if it was the Philippines Red Cross, but it was a Filipino team that did this. And appropriate for the context? It seems so. This was a locally made solution. That's beautiful. I don't see a whole lot of people on the street, so it seems to be working. Okay, I'm going to take another one from Asia. Let's see if it lets me go over there. Okay, this is a video from okay, it might not let me do it. Jesse, if it doesn't load, that's okay, I can talk through it. But there are so many examples out there about messaging and things like that, and we've seen some of them posted on WhatsApp. If you want to share it with us, we can set up a WhatsApp group for Asia Pacific CBHFA. I believe we have one already. We can continue to add to that. And you can share your social media messages, which is what some people have been doing. And we're happy to give you feedback about how appropriate it is from a behavior change standpoint. Okay, Jesse's telling me that the video is not loading. Let me see. Yeah, I don't know how to do it from here. But basically, it was a video of people in Thailand telling people what not to do. And so at the end of the video, you're very confused about what it is that you actually should be doing. So to keep it clear, call to action, communicating a threat, and make sure it's locally appropriate. Okay, I'm going to stop there. I think I've gone over my 15 minutes, and I will hand it over to Nadira. Nadira.
All right, thank you, Nancy, and apologies on my and our team side in terms of the slides and stuff. So yeah, so I would like to confirm if Marcel from the Timor-Leste team is here. Marcel, can I check if you're already online? Okay,
Yes,
I guess.
I'm here.
Do you want to go
Hello.
first, or do you want to present? Okay, I guess they still have issue with connectivity.
Yes, I can present now.
Okay, if you're, I can provide the slide for you. So I'd like to go with Timor-Leste and see if you like to share your experience on CBHFA and COVID-19. Over to you, Marcel.
Okay, thank you. From Timor-Leste, we are doing COVID operation and also dengue. Even we do dengue COVID operation, but dengue cases also come in and killed 6 people. So right now we do operation in both of 2 of the dengue and also yeah, I will present our outline is my outline is current situation, coordination, staff and volunteer mobilization, and also professional volunteer, nurse and doctors. Did you find my screen? Hello.
I present for you.
Hello.
Marcel, I'm navigating the screen for you. So we are on the outline. Yes. You want to go next?
Good. Okay. So far, and we do 5 risk communication activity was and logistic support and challenges. Yeah, current situation as response to COVID-19, His Excellency President of Republic Timor-Leste declared the state of emergency starting from 28 March to 26 April 2020 to avoid a public calamity caused by COVID-19. So far, in up to now, 27 of April, 28 of April, we have the total people quarantined. Before we have 2,152 people, but 1,694 already passed 14 days, and some it's already integrated to their community. And we also total test case we have of 480 tested to people who are quarantined, and 367 negative, and also 89 waiting for result. and so far we have 24 cases confirmed for coronavirus, and it's positive, but 6 is already recovered from the disease, and all these cases imported from the other country because the people come from the outside. They come back from the study in outside, and we quarantine them, and also we test, and they get disease. And on the other hand, we have also 900 dengue cases in Timor-Leste in 5 happen in 5 districts, but highly in Dili, and it's already 8 people dead on the dengue cases. So so far, CBTEL have been signed the MOU with Minister of Health of Timor-Leste for COVID-19 emergency operation, and also dengue prevention campaign. And also we got funding from I4C has been supported CBTL with the global COVID-19 appeal, focus on development of risk communication and community engagement. And so far, coordination in Timor-Leste, CBTL has established the CBTL COVID-19 operational task force, and also structure in national headquarters and also 13 branches, operational committee in all 13 branches. We also developing our contingency plan and continuity business plan is in draft for COVID-19 response. CBTL also being part of National Committee for COVID Response. We call it Centro Integrado Gestão Crise, which means that National Committee for Center of Integrated Center of Crisis Management. And also CBTL also being part of the Timor-Leste Health Emergency Operational Center working group. So all activity, all information from health we can get from this group, this working group. And so far we also mobilizing the staff and volunteer to work since declared lockdown in Timor-Leste. We mobilize a lot of volunteers. There is no staff working, so we no normal work. So we just we mobilize volunteers, and we mobilize 204 volunteers for 13 municipalities, include in national headquarters. We also deployed 10 doctors and 24 nurses in this operation for to provide healthcare to people in quarantine in 16 quarantines. Regularly, we also have a regular brief to staff in 30 municipalities and volunteer in 30 municipalities, and also people who want to work in the field. We also have one advisor for recruit one advisor for COVID operation to this person to approach the Timor-Leste government, how we can have a good coordination with the government. We also conduct a short orientation to all 13 branch for COVID operation. In risk communication on COVID and dengue, we have contextualized the IC materials that we can use for the education. In this site, we are CBTEL is take part on the Minister of Health Committee for developing IC materials, key messages. And so, so far in Timor-Leste, all key message, all IC material should be approved by Minister of Health. And we have to discuss on key messages. We can recommend the key messages, but the Minister of Health has final approval in this context. So we are now all IC material development, we concentrate in Minister of Health. And we have also, because in this situation, it's a lockdown situation, so we record 8 audios to play in using megaphone. These 8 audios is come from the one for COVID prevention, one for the transmission prevention, one for the COVID itself, what is COVID, and some of about the how for some we use leaders, the people, high leaders, to announce the whole community to about social distance, how to put them, give them information about social distance and also quarantine and also isolation about it. We have 8 audios that right now we use for disseminating information in all territory. We also printed a poster that approved by Minister of Health, two types of posters. So one for general community and one for students. So far we are using disseminate the information using megaphone. And in all states, in all 13 municipalities, so far we are covered because we have 65 sub-districts in 13 municipalities. Right now we cover 43 sub-districts and 175 villages. We also right now we developed rapid assessment, and we just applied we just applied it in Facebook, so they can. It was supported by CCT, IFRC CCT in Indonesia, Jakarta, and Timor-Leste. We disseminate information dengue. For dengue, we disseminate information through megaphone as well, and also we support the health centers, district health center to do fogging in Dili because the cases are high, and now we cover it 2,008 households in Dili because it's affected households. We fogging for that. Also, we distribute abate to household, and for water tank we already cover 2,030 water tank in Dili. For wash activity in COVID operation, we established 20 hand washing facilities, the big size, in public areas like public service area like port, airport, border, health center, etc. And also some like clinic, we also provide the hand washing facility. And in some district, we also provide in various district like in Kovalima because it's near border. So we provide small size hand washing facility. We already distributed 98 small size hand facility. We also trained disinfectant to Timor-Leste army, 4 people to do disinfectant in their office in all 13 municipalities. We also provide disinfectant sprayer to 2 disinfectant sprayer to Timor-Leste army, and also 2 to Minister of Health, for especially to support the emergency operational center in Delhi, the interministerial crisis management center in Delhi, for spread the areas for disinfectant. Logistics, so far logistic, we also participate in setting up the health center for the quarantine and isolation in 3 or 4 areas in Delhi, because right now we still all quarantine is still focusing in Delhi, because we set up and we renovate some old building for the isolation, or for the quarantine and also isolation, because we have to use one health center for isolation, and we have to move these sick people, and also the staff in those clinic to move to the other. So we use the place for the isolation. We also supporting tents for screening in screening intervention in health center, airport, harbor, border, and also national hospital. This because like in airport and border, because the visitor and also the traveler, when they come, we have to screen them. And there is also some picture that we display here. That's the activity that our Madam President also participate in, disseminating information for dengue and also COVID to the community in health center. And also we have some fogging fogging picture, and also megaphone. Then also our Secretary General and also our health coordinator also participate in carrying the people in the quarantine. That's all my presentation. If any question, please. Thank you. Back to you, Nadira. Thank you.
All right, thank you, Marcel. And I'm sorry about this this messy slides, because we have problem with internet connectivity nowadays. And okay, we will open the Q&A session later. So I would like to invite Minoli from Sri Lanka Red Cross to present first before we open to question and answer session. So if you have any question, maybe you want to write it down, or else you forget, then we can open the session for Q&A. Over to you, Minoli.
Thank you, Nadira. Hi everyone, I'm Minoli from Sri Lanka Red Cross Society. Today I'm going to present what we have done during this COVID-19 response. So this is our national response plan, containment preparedness, social behavioral change communication SBCC campaigns, and then WASH activities, and supporting for the MOH, Ministry of Health. So this is the initial phase of this pandemic preparedness. Here, the SBCC campaigns and the WASH activities are more focused for the behavioral change. The objective of this SBCC campaign is to disseminate the preventative messages among the different vulnerable communities and ensure positive behavior change. Here, we consider the social ecological concept, which start from the individual and expand up to enabling environment or policy level. So during our planning process of this SBCC campaign, we consider this ecological model. So the social behavioral change communication campaign has two components. First one is we have adapted IFRC education materials into local context, and then we disseminate these messages person to person. Hear me?
Minali, you're breaking.
Hello.
Minali, can you
Hello?
try again? You seems breaking just now. Sorry.
Okay. So the first method, the digital method, why we more focused on this method? Because Sri Lanka imposed limits to the field. Therefore, we use this digital method to disseminate the messages. Here are the difference, especially people who are using social media. And we developed some stay home, stay safe messages by famous characters in Sri Lanka and disseminate through social media. And this we have already shared, and more than this campaign, we developed video, which is an educational material. Hello.
Hi, Minali.
Can
Yes.
you hear me?
Yeah,
Okay,
we can hear you,
for
but you are breaking a bit. So.
yeah, sorry for the disturbance. So regarding launched a face mask campaign because there was panic buying of masks in Sri Lanka. So we launched a campaign that who should use face mask and how to use this mask properly. In collaboration of Sri Lanka government say that it is compulsory to wear mask when you are going out. So, educate, we develop this message. And then, especially people who are having symptoms of COVID-19 have a little bit stigma that seeking for the medical. Therefore, we developed a through the social media. During this response, sorry, can you hear me?
It's breaking a bit. Actually, a lot. Minali. Hello, Minali. Are you still online?
Okay,
all right.
No. Yes. So this PSS we disseminate this message targeting the general public who are distressed due to this prevailing situation, and hello.
Yes, please.
Minoli, if you can log out and log in, maybe the thing sometime improves. Can you try that one once?
Okay, sure. I think it's connectable, so I will continue.
Minoli, are you online?
I'm online. So, okay.
I think the network is really bad on your side. Right. Nancy, would you like to add something on what have been done on social behavior change communications? Maybe Nancy would maybe you want to say something on this that I think is quite a new field. It's pretty new to myself as well in terms of how can we communicate better to change a lot of behavior. Like, you know, a lot of social distancing is not something I'm familiar with, not my family familiar with, not our community familiar with. So how can we adopt this new norm? There's a lot of people talking about this new norm and how we can change this into a new practice. Nancy, would you want to add something into that?
Yeah, it's a good point. So we are changing norms. We're having to change social norms. So those of you who are familiar with doer, non-doer, you know we ask those 7 questions. We ask about positive consequences, negative consequences, social norms, like who would approve of you doing the behavior, who would disapprove of you doing the behavior. Religion, is your religious leader actually in agreement with this actual thing? Is there access to soap and water? So you have to consider all those things that community members need to be able to change the behavior. So as role models, as I have said before, you are modeling what it is that they should be doing. So when they continue to see you doing the right thing, they're going to then start to do the right thing as well. Or when they're not doing the right thing and they see you, they'll jump back and say, oh, you caught me, I wasn't doing the right thing. But that's good. That's the kind of mindset we want to start changing for them to now recognize that the new normal is something that will keep them safe from COVID. Okay, can I also just share my screen really quickly? I don't know how to do that, but
Sure.
I just want to show you some resources really quickly. Is there, oh, here it is. Okay, there's a lot of buttons on my screen. 1 second.
It's next after the mute icon.
Okay, so do you see a PowerPoint slide?
Yes.
Okay, cool. All right, so just a couple of things. I think we've disseminated this a bit, but I'll continue to do so. So for IFRC, we have a CBHFA COVID module. It's both in print as well as online. So if you go to the CBHFA site, you can click there and then get the information. We are updating it though. So we're updating it with revised symptoms as well as some guidance on masks and home care. And I actually would love to use information from you. So if you as a National Society has home care and masks guidance, if you could send that to us, we'd happily use that. We'd love to have it informed by our CBHFA teams. And then of course, we'll just distribute that and I'll send out an email to the regions and they can let you know when this material is going to be updated. And again, we've put it in a format so it can be updated quickly. You don't have to wait weeks, etc. We also have a global webinar with our co-facilitators. We have co-facilitators from every region, including Nadira and Eka from PMI on April 30th. Okay, so that webinar is here, and I'll send you this information as well through Jesse. It's April 30th, 4 p.m. KL time, and it's meant to be something like this. However, it's much more global. So we have 4 regions. We couldn't do Americas because of time zone. They'll have a separate one. It'll be 4 regions talking about their lessons learned, challenges, etc. There'll be breakout rooms to be able to talk about what you're doing in CBHFA, what challenges you're having, and then posing some of those challenges to come up with community-fed solutions. And then finally, we have, we're in the process of digitalizing eCBHFA. So we're working with the Portuguese Red Cross as well as hopefully the Timor Red Cross. And we're wanting to put CBHFA in an e-format so that people who want to refresh their skills or people who want to start up with CBHFA can do so virtually. Now, it doesn't replace a whole week of face-to-face. I get that. But it is a way for us to start to bridge that gap between expensive face-to-face trainings that last a long time and cost a lot of money. And when a national society says, right, we want to do this and we want to do it next week, they can start. So this is the foundation. So we're testing it in Portuguese and English, and I'm actually looking for pilot national societies now. What does that mean? If you're just one person from Cambodian Red Cross, you're piloting. I would love to be able to send you some links. You take the e-courses, you give me very honest feedback. And we'll do that in May. So it'll be a very quick turnaround. We're only doing 4 modules for now, just in terms of time restraints. And each module takes about 30 minutes and then another 15 minutes for feedback. So if you're interested in being one of those pilots people, be able to give feedback on some of these testing materials, please let me know and I will happily send you things. I can give it to you in English or in Portuguese for now, and then we'll expand to the other languages. And then finally, the I4C has a platform for sharing experiences across volunteers. They are recognizing that volunteers are the sole reason that we exist. You as volunteers and you as staff at the community level are the heart of what the Red Cross Red Crescent does. So there's a platform actually being launched next week. We'll do a little bit of a preview on the global webinar on Thursday, but it's a chance for people from across the world to be able to share their lessons learned. It will be available in 60 different languages, and we'll see how that rolls out. I will send around these slides so that you can click on those things much easier. Okay, that's it for me. Over. Thank you.
All right, thank you, Nancy. That's a great information that we have from you. I heard Minoli is back. Can you confirm with us? Are you back, Minoli?
Yes, Nadira, I am back.
Right. Okay. Can you? Yes. Yes.
Can you see?
I can see your slides here.
Okay. Thank you. Sorry for the disturbance. So I will start from here. The mask video. Why we developed this video? Because of Sri Lanka government says that it is compulsory to wear a mask when you go outside. So we wanted to educate the community how to wear a mask properly and how to dispose it. Within that intention, we developed this material. And also, people who have symptoms of COVID-19 are really wouldn't like to go for the medical treatment, maybe because of the stigma. Therefore, together with the Ministry of Health, we developed this stigma prevention cartoon and shared through the social media. Then the PSS activities we have included into our national response, especially the telecross service, which enable the people who are distressed due to this prevailing situation to talk with and have the PSS services from Sri Lanka Red Cross Society. As well as we have considered about the staff and volunteer care. Sorry. So we disseminate messages every day, not being stressed and how to work very calm and quiet manner. I mean, in a like a distressful situation like this. So you can access our this communication videos through these links if you like. And I would like to move into the second second dissemination channel, that is IEC material distribution. So we mostly targeted the transport modes, especially like three-wheels, buses, and trains, to educate the community who are traveling using those transport methods. Then we encourage actually the zero contact IEC distribution by establishing leaflet dispensers in some critical areas of Sri Lanka. And then we also disseminate our messages, leaflets, and the trifolds, especially with the relief pack that are sharing to the most economically damaged, people who economically affected. So we believe those people who are economically affected at this time are not much access to the right information. So we use this opportunity to give this message to those people. And then we use this person-to-person communication strategy. Under that, we conducted small group awareness. Actually, when conducting this kind of small group awareness, we encourage those people to maintain the social distance and also access to hand washing facilities. Then, of course, people who are not getting the COVID-19 prevention messages properly, we conducted public addressing method. And also, door-to-door visit we conducted, as well as the public places awareness through our IEC materials. So we believe that throughout our through the IEC campaign, we could able to reach most vulnerable people and most deprived segments of the society in Sri Lanka. Our last strategy is to facilitating for enabling environment and behavior change. In order to promote, especially the hand washing, we established water points in public places and also behavioral focused community activities, especially the hand washing activities we have conducted, plus the demonstration activities. Then we have conducted social distancing awareness programs, especially when people go to the groceries when the curfew lifted. So we got that opportunity to educate these people, to educate about the social distancing. And of course, we are conducting disinfection activities, which comes like a comprehensive package. Like we are doing first time disinfection, and then we encourage and train the those people who work in those institutions to disinfect next time they are placed by themselves. And also, when conducting volunteer capacity development programs, we used zero contact and social distancing methods, such as you can see, especially when they're physically available in our branch, we recommend them to maintain social distance and also facilitate for hand washing. And also, we have conducted online trainings, especially for PFA to the volunteers. I would like to highlight that what is Nancy said before, volunteers should have to be key model before they go to the community, because from that community learn from the volunteers. So that's why we encourage our volunteers when they deploy to the field, especially maintain the social distance and try to be innovative to use to adapt to the situation with zero contact. And that is the end of my presentation. Thank you very much.
Thank you. I would like to take like maybe 10 minutes of your time to take some question. If we have any question from the participants, to Nancy or to Minoli, we're happy to take some. I think Marcel is still with us, but he might have difficulty in his connection, but he more than happy to take as well. So do we have any question from our participants? Anyone?
Hi, this is Hannele. Can you open the chat box, because we can then write the questions to the chat box. My question is that for both who presented Sri Lanka and East Timor, how many volunteers you have involved in these programs? And for Sri Lanka especially, it was very nice to see that you have used the behavior change models which we have recently discussed. Thank you.
Hi. Actually, we have around 500 volunteers per branch, 20 and 25 branches, and roughly 500 volunteers deployed into this response.
Perfect. Any other questions?
Okay. Hello. Can I ask the question to both CVTL and also Sri Lanka Red Crescent? First of all, thank you. It's a wonderful job you have been doing out there. Really appreciate it. My question is more on like a caring for a volunteer. What you have done for your volunteer, like how you ensure that support is being given to those who are working, you know, like almost every day for this response. Thank you.
Thank you, Devendra. Minoli, would you like to take the question?
Yeah, of course. Actually, we consider about the volunteer protection as well. Especially, we educate them and develop their capacity before go to the field, especially how to protect themselves. Especially, we provided sanitizers to the volunteers when they're going to the field to use it. And if they need, we provided gloves. And other than that, we have not we didn't work for the critical response, especially in quarantine sites or hospitals. Therefore, we ensure the people who are deployed to the field to carry out a sanitizer and also wear gloves. But there are some hospital administration activities. In such case, we educated them to wear a mask and also to remove the mask in each 2 hours. And dispose it and wear a new mask. Over.
Okay, so my question is more on psychological support to the volunteers that mobilize. Sorry if I didn't make it clear. So the question is for both Sri Lanka and CVTL. Thank you.
Right.
Yeah, actually, we consider that part as well, volunteer care. So we are conducting basic PFA training programs for them, and also we hope to conduct debriefing activities for the volunteers.
All right.
In future, yeah. Over.
Marcel, would you like to comment on what have been done in your national society in terms of psychological support?
Yes, from Timor-Leste so far we are trying to develop in our volunteer insurance with assisted by the IFRC representative here, and also every day when we are doing activity, before we are doing activity, we always brief our volunteers to stay safe and before they are doing activity and their safety, and we also brief them how to use mask and also hand scoop and also doing social distance in the in the field. Even the people are also our volunteer. Also, some of them is working with in the border area and also at the airport. So we always brief them before doing activity. Thank you.
All right, thank you, Marcel. So I have a question for Nancy, and I think this is something that people have been coming and asked. I mean, if I'm from National Society and I'm interested to start my CBHFA program in my National Society, what should I do? How do I start? What are the first steps? Who I should contact? And how do I do this if I want to, interested to do this CBHFA and wanting to introduce it in my National Society? So I guess Nancy, if you can give us some detail on how National Society can take this forward. Thank you.
Sure. Well, it's a funny answer because I would reach out to you. So as the point of contact in Asia Pacific, I would reach out to Nadira. You may already have a national CBHFA in your national society, just not in your branch. So if you reach out to your national society to find out if it actually exists in the country, if it doesn't, then reach out to Nadira, and she can help you kind of get you started up. So Nadira and I work together quite a bit, and so we can provide online support. But Asia Pacific is such a strong region. There are national societies across Asia Pacific that can also support. So there are some online courses. Like I said, we're trying to digitalize CBHFA, so we're trying to give a foundation before you even step into a classroom. There are enough materials online that you can familiarize yourself and then get support to kind of coach people through doing some CBHFA. Yeah. Now, if you do it in specific contexts, there's different rules. So we have CBHFA in prisons. There's a different set of rules for how to do that there. CBHFA in schools is different than CBHFA in disaster, than it's different in pandemic. So just reach out. There is so much experience across this region and across the world that can help to give you that feedback. So that platform that I'll send you the URL for, that will also be a chance for you to be able to talk with people around the world about how to basically start CBHFA, refresh CBHFA, keep it going in the midst of pandemic or disaster or anything like that. So we're here for you.
Right. I like that slide.
May I just add that Philippines
Yes.
Red Cross, Cambodia Red Cross, and Indonesia Red Cross got also last year training, so that there are regional trainers who can support you, and you can request them from Nadira too.
Exactly. Yep. So there we have master facilitators who are actually in this audience now. We have Ellen from Philippines, we have Vanta and Sana from Cambodia. We have Astrid from PMI. We have Nadira. They're master facilitators, but there are many other master trainers that are available for deployment that can work with you and coach you either on the phone or one-on-one. Thanks for that, Hanalei.
Right. And I guess that's all the time that we have. And I'm really, really thankful. Thank you so much, Nancy, Minoli, and also Marcel for the presentation. And I'm so sorry on behalf of IFRC APRO in terms of the technical glitch that we have throughout this webinar. I hope that the webinar is useful for all of you, and you have get something out of this that you can use in terms of your response in COVID-19, something that we can learn from each other. That's what all the CBHFA is all about. We want to, learn from each other and, pick what best from each national society and adapt it to our, culture and our community. So I guess with that, I want to wrap this meeting, and we will disseminate all the presentation and some of the materials that has been shared by Nancy to all of you, so you can go back go through the slides when you have free time. We also record this webinar, and you can have a listen to it whenever you are free, if you want to go through over it again. And yeah, so that's all we have so far. And thank you everyone for coming. Thank you for the presenters. Thank you so much, and hope to see you guys again next week. Thank you.
Thank you.
Thank you.
Thank you.